Where is the lesion? What is the lesion?
Okay. I'm not able to understand this.
Okay, so just trying to give you an idea of the, let's say, an assessment of the cranial nerves in this patient's face. So,
Yes.
and I guess what I should have done actually made that a little bigger. Does that help?
Yes. So the eyes is deviated. What do you call the left eye is deviated
Yeah.
on the outside. So this should be um, in the cavernous sinus.
Yeah, that's a possibility. So maybe take a step back first. What would your instead of thinking about the etiology, how would you characterize this lesion? Or what particular nerve dysfunction is causing this scenario?
So LR6, right? Lateral rectus.
6 will be a lateral rectus palsy, which is definitely something important to consider in the setting of subarachnoid hemorrhage, because it's not uncommon for them to develop hydrocephalus, and sometimes they'll be awake. But when you do the extraocular muscle exam, you'll see that the lateral rectus is not working. For this particular patient, what I've poorly illustrated is a dilated pupil. And kind of like a down and out orientation of the left eye. I don't know if that helps you at all.
That's cranial nerve 3 then?
Yes, yeah. So
I don't understand the drop either, sorry.
Yeah, no, that's fine.
Yeah.
So we're looking at a patient with dilated pupil, down and out eye deviation. What are you thinking in terms of etiologies for acute third nerve palsy?
PCOM aneurysm or diabetes?
Okay, so how do you tell the difference between the two?
I want to say that I knew the answer to that a long time ago, and I don't know. But I think it's the way that it presents, like, gradually over the course of time, whether it's acute or not, because diabetes is inside to outside versus aneurysm is going to be a compression of the nerve from outside to inside almost.
Yeah, no, that's absolutely right. So the parasympathetic fibers are running on the exterior surface of the superficial surface of the nerve, if you will. So with external compression, you might just get a dilated pupil. But usually if you get the full third nerve palsy with the ptosis and the down and out eye here, then with the dilated pupil, then it's just the whole nerve compression. But you might get just pupil dilatation. So in general, you're thinking external compression of the nerve, and you're going to see this same thing with uncal herniation, and I guess a brainstem stroke. But then with that, you're going to see contralateral weakness, all starting at the same time. So the diabetic third is a pupil-sparing third nerve palsy. So usually the collateral blood flow to the nerve is on the exterior surface of the nerve. So if there's a diabetic origin to the down and out eye, and then the pupil is usually spared. So that's usually the way to differentiate that. So for this particular patient, this is a left internal carotid injection. So that's the left internal carotid artery. It's a lateral projection, a view from the side. So you can see the anterior cerebral artery branches there, middle cerebral artery branches here. And this patient has a large posterior communicating artery, or it might even be a fetal origin to the posterior cerebral artery because it's so big. The only way to know that is to image the posterior circulation. But just like you said, the PCOM aneurysm in that location certainly is a cause for third nerve palsy at times. And so this might be a situation where the patient doesn't have a headache, and they may not have hemorrhage yet. So sometimes we do see the thunderclap headache plus a third nerve palsy, and that really pushes you down to a probable ruptured posterior communicating aneurysm. But even if they don't have a headache, it's possible that the aneurysm grew just a little bit and it's about to blow, but that third nerve palsy, with the pupil involved, is a warning sign that there's something potentially life-threatening. So even unruptured aneurysms can still be symptomatic from mass effect in a few select cases, and in this case, that mass effect is a pretty scary diagnosis of a probable aneurysm that's about to blow.